Hi there, I'm Jocelyn with Sunshine Therapeutics and the Voyage to Heal. So my mom was complaining that she was getting some pain behind her knee, and I made sure, first of all, since she has a history of blood clots, that she had no blood clot. Very, very, very important. And so that was cleared, and her doctor said use a brace and some tape, ice heat, and Advil. So as her daughter being an occupational therapist, I love Kinesiotape. So I decided I'd make her a video and show you as well how to use the Kinesiotape to quiet down some discomfort behind the knee. And she also mentioned she was having a little bit of calf discomfort, so that's where I was thinking maybe she strained her calf a little bit. So we're going to use the tape to get this muscle to stop pulling. Like it's already been stressed. Maybe she overused it somehow or another. So what we're going to do, and I'm going to turn my back to you a little so you can see how I'm taping this, because I'm going to go for the soleus muscles that are coming up along this way and attaching right here behind the knee. And to do that, I'm going to put my foot on a stool. Number one rule when you apply Kinesiotape is always to make sure the muscle is on a stretch and that your skin is clean. So if you have any lotion, you're not going to get very far. So you're going to tear the piece of tape, or the piece of paper, so that it opens up like this, and take off the end. I am going to place this, I'm going to use two strips. So I'm going to place this one right behind my knee. I don't want to get it in the crease because you get really sweaty there. So right behind the knee. I have my heel down, so it's putting this on a nice stretch. And I have my anchor piece here that had no tension at all, about an inch or so. I like to pull the paper off of the tape until the second anchor piece right here. And I fold that back. Then I'm going to put this on a little bit of a stretch and then smooth it out. No tension at the very end. Now, the reason I put a little bit of tension on there is because the Kinesiotape is going to recoil in whatever direction I first started. So I started it right here at the origin of the muscle. And I want that muscle to be pulled back up here so it quits pulling down on the knee. I'm going to take the second piece, if you can see that at all. I know it's a little tricky. Maybe I'll come this way. I'll turn my angle. And the second piece I'm going to do on the inside in that same exact fashion. Okay, my foot is actually bent down like this on a footstool. I'll back up so that you can see that a little bit better, maybe. I'd have to back up a lot. So my foot is on a footstool so that I can get a stretch in my calf area. And once again, I'm going to put it on right behind my knee, and I keep it bent so that I can't get into that crease at all. Just as I did with the other piece, I take the tape off of the paper. I apply about a 50% stretch, smooth that out, and press it down like this. Now, it is heat activated, so when you rub it, it allows it to stick exponentially better. And now hopefully she just leaves it alone, wears it for like 2 or 3 days, and does not apply any heat. Do not apply heat when you have Kinesiotape on, because it's an adhesive, and if you apply heat, it will stick very, very, very well. Likewise, don't apply lotion to it. That will make it come off. And so hence, when it is time after 2 or 3 days to take it off, you can use lotion or rubbing alcohol. And when you do that, just grab where you had started the tape, and one of two options. Either A, you can hold your skin as you're peeling the tape off, because then it doesn't pull on your skin as much. Or if the tape has stuck really, 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 really well, get a washcloth with some rubbing alcohol. And I'll just demonstrate with this that, say this has rubbing alcohol on it. As I take that first layer up, I'm going to just brush along where the tape is and use the rubbing alcohol to dissolve the adhesive. So it doesn't take a layer of skin off when you're trying to put the tape on. There is no advantage to keeping this tape on more than 4 days, as the elastic value of it wears off, and all you're going to do is make it stick to you a lot more. If you have hairy legs, I would suggest shaving them before you put the Kinesiotape on, because the tape needs to be against the skin, not the hair. You're going for that input to the skin and the lymphatic system and all those muscles, and the hair will prevent that from happening. And when you go to take it off, that hair is going to come off anyways. So might as well shave the area, save yourself some pain. All right, I hope that helps. And if you would like any further information, visit sunshinetherapeutics.com. There's an entire hour video on Kinesiotaping made easy that is yours for purchase for about, I think it's $15. So I look forward to seeing you again, and Godspeed on your voyage to heal. Bye.